So if you're diagnosed with the cancer, I would strongly recommend maybe getting a genetic testing. Why am I saying this? There are certain cancers, like ovarian cancer for instance, chances of having a genetic mutation is about 1 in 5, very high. That will have implications for your immediate cancer management. Also, it will give lots of information about with these certain types of treatment will actually work for you as well. Let's say the second most commonest one is basically breast cancer, where there is a genetic predisposition discovered in about 1 in 10. Now, I did one of the studies in Australia, which is today the largest genomic study, having 650 breast cancer patients. And what we've discovered is exactly that 1 in 10 do have a genetic mutation. The surprising thing is that almost half of them did not have a family history of breast or ovarian cancer. That was a very surprising, astounding fact. Did that discovery of that mutation change their patient's management? Absolutely. Why am I saying that? Normally, if you're discovered with a genetic mutation, or a breast cancer without a genetic mutation, you would have what we call a lumpectomy for your initial breast cancer surgery. That means people now very rarely go for a full mastectomy. That means removing the entire breast. Definitely not required for most of the cancer management. But unfortunately, if you have a BRCA1 or a BRCA2 mutation, your risk is actually quite real. That is not 1 in 8 anymore. A chance of another breast cancer in the same breast or the other breast is quite significant. So in that kind of a context, you may have to consider a full removal of the breast and potentially both breasts as well. What it does for you, it actually avoids you from unnecessary certain interventions like radiation. Now obviously we have discovered that having certain mutations like BRCA1 and BRCA2 does not increase cancer risk by radiation. So having that genetic testing actually avoided those patients having radiation, and it did change the immediate management. And what is kind of more relevant in 2025 context is that now, we've discovered that you have a genetic mutation, so I can actually target that genetic mutation in your favor to introduce newer drugs. Even certain chemotherapy agents are actually more effective in certain patients with those genetic mutations. Like for instance, platinum chemotherapy. If you are discovered with a genetic mutation, I would actually tend to use platinum before any more chemotherapy. So what it has done is that once we discover the genetic mutation, surgery has basically changed. We avoided radiation altogether and we discovered newer agents, including some of the old agents like chemotherapy, definitely can actually help you battle your cancer. Next thing is it actually informs your family's risk as well. Now these cancer genes are inherited in what we call autosomal dominant fashion. That means if you have it, irrespective whether they're a male or female or boy or a girl or a son or a daughter, they have a 50% chance of inheriting that genetic mutation. So in a way, by being brave enough and then you're doing the test, you're actually sort of informing your family's risk as well. So it has to be sort of really commendable. And then say in Australian context is that we actually refer them to a familial cancer care services and offer free testing for all the family members as well, and to make sure that we've identified each and everyone in that family who is carrying this genetic mutation, and have an excellent surveillance program to make sure they do not get cancer. So message is very simple. You should consider genetic testing for pretty much most of the cancers these days, especially breast, prostate cancer, ovarian cancers. That will change your management, gives your oncologists, radiation oncology surgeons many options, and also you are doing this for your family as well. And they are in a unique situation to make sure that they can take preventative steps, go for appropriate surveillance so they will never get cancer.